Good evening, one and all. I welcome you all for the Pragnavaridhi lecture series conducted for second year BAMS students. Before which, I would like to introduce our team Panchajanya. Panchajanya, the divine conch of Bhagavan Sri Krishna, which was blown during Kurukshetra, indicating the start of the Dharma Yuddha that followed. There are all the efforts were done for the establishment of Dharma. Dharma was kept over personal relations and motives. Keeping the same motive in mind, our organization will work towards establishing the importance and necessity of following and imbibing Bharatiya culture, accepting our roots, and making people realize the true essence of Ayurveda not only as a treatment modality but also as a way of life. All these while walking in the path of Dharma. Hence, the motto Shreyam Bharatiyam Arogyam Ayurvediyam. With this aim in mind, I would like to welcome you all to Pragnavaridhi lecture series conducted for second year students. Today we have with us Vaidya Abhishta. We warmly welcome you to the session, sir. It's an honor to have you in the session. Sir has pursued UG and PG from Alva's Ayurveda Medical College and is presently working as assistant professor in Roga Nidana department, Alva's Ayurveda Medical College. Practicing since 4 years at Praveen Clinic, Osmar, Karkala Taluk. Sir has done presentation in various national and international seminars. Sir is also in charge of various seminars like Tejas and workshops like Jnana Chakshu organized at Alva's Ayurveda Medical College. Sir has done his thesis work in an observational study on Marga Avaranajanya Hridroga with respect to coronary artery disease. Handing over the mic to you, sir.
So, thank you for the introduction. So, first of all, I thank the Pragnavaridhi team for giving me an opportunity to talk today. So, without much delay, we will straight away start the topic that is given to me is Galaganda. So, as you, the second year students, know, the Galaganda is coming under the third term topic, and it is a nice to know topic where you can expect only a multiple choice questions. Okay, so nice to know topic. So these are the learning objective like Galaganda. So the learning objective is describe Pratyatam Lakshana and Samprapti of Galaganda. And next, in the contemporary understanding, we have thyroid disorders, where it is a desire to know topic where you can expect a 5 marks questions and also a MCQ question. So learning objective in the thyroid disorders are like describe the clinical features of hypothyroidism and hyperthyroidism, perform relevant clinical examination of hypothyroidism and hyperthyroidism, and order and interpret relevant investigations of hypothyroidism and hyperthyroidism. So we will start with Galaganda. So as you know, this is the learning objective describing the Pratyatma Lakshana and Samprapti of Galaganda. So before going to the detail of Galaganda, so you students should know the references where Galaganda is seen. That is in the Charaka Samhita Chikisasana 21st chapter, Shvayatu Chikitsadhyayam, where Galaganda has been mentioned. So in Sushruta Samhita Nidanasthana 11th chapter, there's a chapter named Granthi, Apachi, Arbuda, Galaganda Nidanam, where Sushruta is mentioned. In Madhav Nidana, that is 38th chapter, that is Galaganda, Gandamala, Apachi, Granthi, Arbuda Nidanam. And Vagbhata has mentioned in Uttara Tantra, that is 21st chapter, in the chapter Mukaroga Vijnani Adya. So these are the list of references you should know where and all Galaganda has been mentioned. So beginning with the Pratyatma Lakshana of Galaganda, where Charaka has beautifully quoted, that is Galasya Parshve Galaganda Ekaha Syat Gandamala Bahubistu Gandehi. So Galasya Parshve Galaganda Ekaha. If there is one swelling inside of the neck, it is called as Galaganda. Syad Gandamala Bahubistu Gandehi. If there are multiple swelling, that is Bahubistu Gandehi. If there are multiple swelling around the neck, it is termed as a Gandamala. So here we can differentiate what is Galaganda and Gandamala. So Ekadeshya Shota present in the neck region is Galaganda. Bahushota, that is Bahubistu Gandehi. Multiple swelling which is present around the neck, it is called as a Gandamala. So to picturize, we can say Galaganda, where Ekadeshya Shota, which is can be considered as a simple goiter, is Galaganda, and Gandamala, where we can see multiple swelling, where in the contemporary science we have a concept called multinodular goiter, which can be compared with the Gandamala. So there's a differentiate between Galaganda and Gandamala. Next, Sushruta has mentioned Nibaddaha Shvaituryasya Mushkaval Lambate Gale Mahan Va Yadi Va Hrisvo Galagandam Tamadished. Na sarva eva galashayo gando galagandaha. So Sushruta is telling not all the swelling which is present in the Ganda Pradesha or in the neck region can be considered as galaganda. Not all the swelling which is present in the neck region can be considered as galaganda. Only those swelling which is having the appearance of a mushkaval lambate. So mushka, Dalana comments mushkavat andavat, that is having the appearance of a scrotum hanging around the neck like the appearance of a mushka or scrotum can only be considered as galaganda. So this can be considered as a pratyatma lakshan, that is a nibaddaha shvaituryasya mushkaval lambate gali. That term mushkaval lambate is considered important here by the Sushruta Samhita. So next, that is regarding the pratyatma lakshana. Next, that is regarding the samprapti of galaganda, that is yasya sleshma prakupito galabahe avatishtate. According to Charaka, so here students you have to remember, according to Charaka, only kafadosha samprapti, only there is a involvement of kafadosha in the galaganda samprapti, whereas Shushruta has mentioned vataha kafascheva gale pravruddho manyetu samsitya tateva medaha. So Shushruta and Madhava told about vata and kafadosha visheshan. So this might be an MCQ question for you. So dosha involvement in the samprapti of galaganda. So according to Charaka, that is kapha dosha, whereas Sushruta, you have to remember he has mentioned both vata and kapha dosha, and also medas is also involved in the samprapti of galaganda. Next is a Sankhya Samprapti, so or a classification of Galaganda. So Charaka attributes, as you know, the Samprapti of Galaganda, where Charaka has told only regarding Kapadosha. So you can expect only there is a Kafaja Galaganda, or he has mentioned only one type of Galaganda, that is a Kafadosha predominant Galaganda, whereas Shushruta and Vagbata both have described three types of Galaganda, that is Vataja, Kafaja and Medoja. So this might be also an MCQ question for you. What is the Sankhya Samprapti of Galaganda according to Sushruta? So your answer should be Vataja, Kafaja and Medoja Galaganda. So next, coming to the individual, that is Vataja, Kafaja and Medoja Galaganda. So rather than understanding all the Vataja Galaganda shloka, so here you have to remember some of the important points here, which is a hallmark feature of that Galaganda. For example, Vataja Galaganda, you have Krishna Siravanaddaha, the Galaganda, or a goiter which is covered with a network of black veins, that is considered as Vata Jagalaganda. And also one more important point in Vata Jagalaganda is Yadricha Pakamiyat Kadachit, that is it forms pus without any cause. So in case of Vata Jagalaganda, you have to remember these 2 points, that is Krishna Siravanadda and Yadricha Pakamiyat Kadachit. So next in Kafaja Galaganda, again the important features here you have to remember is Savarno, that is this is a type of goiter or a thyroid swelling where it is having same color of the body. So we can't differentiate between the color. So there is having a same color of the body, and also chirabi vriddhim chiracha prapachate. It grows slowly. That is chirabi vriddhim and chiracha prapachate, forms pus slowly. So these are the two main features explained in Kafaja Galaganda. So next, Medo Jagalaganda. So Medo Jagalaganda here, very importantly, you have to remember Pralambate Alabuvat Alpamulo. So Alabuvat Alpamulo. This type of Galaganda hangs loose like a picture god with a small base, that is Alabuvat Alpamulo, and also Gale Anushabda Kurute Nityam always produces a second sound of voice. So these are the two important features explained in Medojagalagan. That is Pralambate Alabuvat Alpamolo and Gale Anushabda Kurutecha Nityam. So here in this Vataja, Kafaja and Medojagalaganda. So as this is a nice to know topic, you can expect MCQ questions. So these two might these points can be asked. So for example, Krishna Siravanadaha is an feature of dash Galaganda. So your answer should be Vataja Galaganda. And sometimes they might ask Pralambate Alabuat Alpamulo is the feature of dash Galaganda. So your answer should be Medoja Galaganda. So these are the points which are important for you. So that's it. So this is the learning objective which has been mentioned in your syllabus, that is regarding the pratyatma lakshana, that is galasya parshve galaganda ekaha and chat gandamala bahuvistu gandehi, and nibaddaha shvaituryasya mushkaval lambate gale is also the pratyatma lakshana. And under the sankhya samprapti you have to remember sushruta and vagbhata has mentioned three types, that is vataja, kafaja and medoja. And these individual important features of individual galaganda, that is vataja, kafaja galaganda and medoja galaganda, you have to remember. So that's it regarding the Ayurvedic concept of galaganda. So next you have the desire to know topic, that is thyroid disorders. So here, as it is a desire to know topic, you can expect a 5 marks question, that is short answer questions, and also a 1 MCQ question. So as it is a desire to know topic, but still you will come across a lot of patient when you start practicing thyroid. So I consider this thyroid disorders as a must know topic for your clinical practice. But as per your syllabus, this is a desire to know topic for your theory purpose. But you have to know these thyroid disorders in detail when you start practicing. So as we all have studied in physiology regarding the thyroid hormones, where hypothalamus thyroid hormone production is regulated by the hypothalamus and the pituitary gland. The TRH, thyroid releasing hormone, stimulates pituitary thyrotropin synthesis and secretion. In turn, TH stimulates production and release of T4 and T3 from thyroid gland. Once, because of THS stimulation, T4 and T3 are released. Once released, T4 and T3 exert a negative feedback mechanism on the production of TRH and TSH. This is the hormone regulation in terms of thyroid gland. So this is important for you to understand the further concept. So we have thyroid disorders. There might be hypoproduction and hypofunctioning of thyroid gland or hyperfunctioning of thyroid gland. So hypofunctioning of thyroid gland results in hypothyroidism, and hyperfunctioning of thyroid gland results in hyperthyroidism. So first we will learn what is hypothyroidism. So whenever a 5 marks question is asked, you have to begin with this the definition, that is hypothyroidism is a condition characterized by decreased production of thyroid hormones by the thyroid gland, leading to reduced metabolic rate. So that is the classical definition of hypothyroidism, which you have to start with. And as we all know, the female to male ratio, so predominantly female is the one who is having a incidence of hypothyroidism more, that is ratio is 6:1 in female to male ratio. And there is generalized slowing down of metabolic process due to hypofunctioning of thyroid gland. And especially when there is a congenital hypothyroidism, or if a newborn infant is diagnosed as hypothyroidism, we name it as cretinism. So this is important for you. So cretinism can be asked as a MC question. What is cretinism? So it is a congenital hypothyroidism seen in newborn infants, where there will be mental retardation, or there will be reduction in growth in the baby also. So that is called as cretinism. So that's it regarding the introduction. So coming to the etiological factors, leading to hypothyroidism. So as we all know, there is a primary hypothyroidism, secondary hypothyroidism, and a tertiary hypothyroidism. So primary hypothyroidism involves a thyroid gland itself. That is a etiological factors causing primary thyroid hypothyroidism are the iodine deficiency, and also we have the autoimmune pathology, that is Hashimoto's thyroiditis. Also we have congenital hypothyroidism, post surgical after a thyroidectomy, drugs like some of the cardiovascular drugs like amiodarone, which will finally lead into primary hypothyroidism. So these are the etiological factors for primary hypothyroidism. So secondary hypothyroidism, where there is involvement of pituitary gland, so we can expect the pathology in the pituitary gland, where pituitary tumors are causing secondary hypothyroidism, are the etiological factors for secondary hypothyroidism. And tertiary hypothyroidism involves a central nervous system, where we can expect a tumor in the hypothalamic and also trauma or infiltrative disorder. So these are the etiological factors for primary, secondary, and tertiary hypothyroidism. Next, coming to the clinical features. As we all know, thyroid gland is a must hormone for the various metabolic process in the body. So we can expect, if there is any hyperfunctioning of thyroid gland, we can expect a multi-system level symptoms which will be seen. So beginning with, we can start with the general features which will be presented by a hypothyroidism patient, that is like fatigue, lethargy, weight gain, that is unexplained weight gain, and also cold intolerance. That is, these four are the classical general features which can be seen in every hypothyroidism case. Fatigue, they will be always lazy. Lethargy, not able to work, not able to wake up from the bed. Lethargy, weight gains, sudden weight gain, and also cold intolerance. So these are the four general features. So next, coming to the skin features. So as I already told, there will be multi-system level pathology will be seen. So skin features we can see in a hypothyroidism case, we can see dry and coarse skin can be seen, as you can see in the image. There will be thinning of hair leading to hair fall, repeated hair fall, thinning of hair, and also brittle nails. So these three are the skin features seen in case of a hypothyroidism case. Next, coming to the facial features. So, as that is the weight gain, you can expect a puffy face also. You can see in the image there will be puffy face and also a periorbital edema. So, these are the facial features which can be appreciated in a hypothyroidism patient. That is a puffy face and a periorbital edema, and the cardiovascular, and in the cardiovascular system, the patient will have a severe bradycardia and also decreased cardiac output. In gastrointestinal system, very importantly, patient will have a constipation, a chronic constipation, along with weight gain. In the musculoskeletal system, the patient will always come to you with a multiple joint pain or a generalized body ache, that is myalgia and arthralgia. And also, in some of the cases, we can see proximal muscle weakness. In the reproductive system, that is there will be menstrual irregularities. So any female patient who comes with the menstrual irregularity, the first test what we suggest is hypothyroidism, or a TS, that is a thyroid function test, because it will hamper the menstrual problem. So menstrual irregularity under the reproductive system, and also infertility. So under neurological, there is depression, poor memory, hoarseness of the voice is seen in neurological problem, and other features like non-pitting edema can be seen, that is considered as mixed edema. And also we can see enlargement of the gland, or goiter can be seen in case of a iodine deficiency. So these are the systemic level features which can be seen. So here you have to remember the general features like fatigue, lethargy, weight gain, cold intolerance. All these are general features. So students, you can write in this manner. So general features like these 4 points. Under the skin features, it is easy to remember. You have to write these three symptoms, that is dry coarse skin, thinning of hair, and brittle nails. Under the facial features, we have a puffy face and periorbital edema. And in the cardiovascular, as you can see in the slides, we have bradycardia and decreased cardiac output, gastrointestinal, musculoskeletal, reproductive, neurological, and other. So that mixed edema, that is in the other features, mixed edema is very important. So you have to mention that point, non-pitting edema, and also in other cases we can see goiter also. So these are the clinical features which can be seen in a hypothyroidism case. So next is a hyperthyroidism. That's it regarding the hypothyroidism in brief. So hyperthyroidism, next is hyperthyroidism. So coming to the definition, we have hyperthyroidism refers to the clinical syndrome resulting from excessive thyroid hormone production leading to an increase in metabolic activity in the body. So there will be hyperfunctioning of the thyroid gland, which will result in increase in metabolic activity in the body. So all the system will get a hyper functioning here. So coming to the etiological factors, so here we can also in the same way where hypothyroidism was categorized, we can categorize under primary cause, secondary cause, and other causes. So under primary causes, that is a thyroid gland hyperfunctioning itself, we have Graves' disease, that is a autoimmune pathology. Graves' disease, autoimmune stimulation of TSH receptor resulting in hyperfunctioning of thyroid gland. There is a toxic multinodular goiter also, which is one of the primary cause. Toxic adenoma, iodine induced hyperthyroidism, excess iodine intake which will lead to hyperthyroidism are considered as primary cause. And also follicular carcinoma or metastasis are also considered under the primary cause which will lead to hyperfunctioning of thyroid gland. So these are the primary causes. So secondary causes where there is involvement of pituitary gland, so we can expect there is excess TSH production. So TSH secreting pituitary adenoma is the secondary cause. And in some other causes we have subacute thyroiditis, postpartum thyroiditis, and exogenous thyroid hormone intake. So these are the etiological factors which can be categorized under primary cause, secondary cause, and other causative factors. So coming to the clinical features, as in hypothyroidism, we have seen a systemic level symptoms. In the same way, in hyperthyroidism, we can see all these systemic levels. So again, in general features, we have, whereas in hypothyroidism, we had a weight gain. In hyperthyroidism, there is a weight loss, unexplained weight loss despite normal or increased appetite, even though patient is having a good appetite or increased appetite, but still he won't be gaining any weight. So his complaint will be unexplained weight loss in spite of a normal or increased appetite. Heat intolerance, whereas in hypothyroidism that is quite opposite. There is cold intolerance. In case of hyperthyroidism, there is heat intolerance, fatigue, and apathy. So these are the general features you have to remember in case of hyperthyroidism. So coming to the dermatological features in case of hyperthyroidism, that is a warm or moist skin, especially in the palms and soles, there will be moistness of the skin, that is warm and moist skin. Sweating, there will be excessive sweating. So patient will usually complain, I have been sweating continuously without any reason. So that is the second complaint. And then again we have fine hair and hair loss. So there will be hair loss, so thinning of hair and hair loss in case of hyperthyroidism. That is regarding the dermatological features. So under gastrointestinal features in hypothyroidism, very importantly diarrhea or increased bowel movements. So there is hyperfunctioning of thyroid gland, there is hyperfunctioning of intestinal motility which will lead to diarrhea or increased bowel movements, anorexia, and vomiting. A patient will come to you with complaining of diarrhea, where we might get confused with a dysentery or a irritable bowel syndrome, where one more differential diagnosis for a diarrhea in a male patient or a female patient might be a hyperthyroidism, which should not be forgotten by you. That is the gastrointestinal symptoms. These three are the symptoms. So next, coming to the cardiovascular, usually patient will complain to you of palpitation or increased heartbeat, awareness of his or her own heartbeat. That is considered as a palpitation. Atrial fibrillation, that is quite a complication in case of hyperthyroidism. That is atrial fibrillation and increased systolic blood pressure. Under neuromuscular complaints or clinical features, we have tremors, there will be fine tremors in a patient. Anxiety, there will be anxiety, irritability, easy irritability, and nervousness, hyperreflexia, and very importantly, a patient will have a proximal muscle weakness will be there. There will be muscle weakness in a patient. And again, coming to the reproductive system, the female patient will have amenorrhea or oligomenorrhea. There will be infertility also, and also there will be loss of libido also. So under ocular, very importantly, ocular or symptoms in the eye, or what are the signs which can be seen in hyperthyroidism patient, that is ocular retraction and lid lag, which I will deal in the future next slide. That is lid retraction and lid lag. These terms are important, very important. So lid retraction and lid lag will be seen in every hyperthyroidism case. Exophthalmos, very important. The first and foremost symptom in the eye of a hyperthyroidism patient is exophthalmos, and different kind of ophthalmoplagia, and also periorbital edema. So these are the systemic level clinical features which should be remembered. So you have to write in this manner. So general features, dermatological features. So it is easy to remember for you. Dermatological features: gastrointestinal, cardiovascular, neuromuscular, reproductive, and ocular. So next, this is exophthalmos, where you can see enlargement of the eyes. So next, coming to clinical examination of hypothyroidism and hyperthyroidism. So next is a clinical examination. So under clinical examination, we can divide under three headings. That is general survey, that local examination, and general examination. So under general survey, hello, ah, hello.
Yes, sir.
So, so under general survey, so can I continue?
Yes, sir.
So okay, sorry. So under general survey, uh, so we have to look for a build and state of nutrition of a patient. So uh, so uh, uh, we have divided into three headings, main headings. That is general survey, local examination, general examination. These are the clinical examination we have to do. So under general survey, we have to ask the patient regarding build and state of nutrition of a patient. So in hyperthyroidism patient, usually patient will be thin and underweight, as already discussed in the clinical features, where hyperthyroidism patient will have a unexplained weight loss. So these patient will be usually thin and underweight. There will be excessive sweating. So if you see the patient, there will be excessive sweating, and also there will be muscle wasting also, proximal muscle wasting also. In case of hypothyroidism patient, it's quite opposite to hyperthyroidism, where we can see the patient is obese and overweight. So even though he's fasting or doing the diet, he or she will be doing the diet, still patient will be gaining the weight, that is obese and overweight. And last importantly, if at all you are suspecting the carcinoma or thyroid carcinoma, you can see the signs of anemia or pallor or signs of anemia, and also the cachexia, severe weight loss can be seen in thyroid carcinoma along with other features. These two are important. So this is important. So hyperthyroidism, thin and underweight; hypothyroidism, obese and overweight; and in case of thyroid carcinoma, signs of anemia and cachexia. So next, under general survey, next is the facial features. So in case of hyperthyroidism, the facial expression of excitement, there will be tension, there will be nervousness or agitation, with or without exophthalmos. So as I already shown you the image exophthalmos, so in the facial features, there will be excitement, tension, nervousness, or agitation, with or without exophthalmos in a patient of hyperthyroidism. In case of hypothyroidism, one can see the puffiness of the face, as you already seen in the other slides, the image puffiness of the face without any expression. There will be expressionless face, or usually the patient will have the depressive face or a expressionless face with puffiness. That is regarding the facial features. Next, coming to the mental status. So if you check the mental status and intelligence of a patient of hyperthyroidism hypo, so usually hypothyroid patients are commonly seen as a dull patient. So as there will be involvement of uh, neuromuscular where depression or mood change. So usually the hypothyroidism page will have a dull patients and usually having a low IQ. Pulse rate, coming to the pulse rate, next general survey is pulse rate, where as we already seen, hyperthyroidism patient will have a palpitation. So usually in hyperthyroidism where will be irregular pulse or irregular pulse, and in hypothyroidism there will be severe bradycardia. The skin features, as we already discussed, in case of hyperthyroidism there will be moist skin, particularly of the hands, and in case of hypothyroidism there will be dry skin and inelastic skin. So these are the general survey which should be remembered. So under general survey, we have built and state of nutrition of a patient. There will be facial features. There is a mental status and intelligence, pulse rate and skin. So this should be known for each and everyone. Very importantly, to diagnose hyper or hypothyroidism. So next, coming to next clinical examination is a local examination. So next clinical examination is a local examination. So local examination of thyroid gland is performed by the examination of the neck, where the clinician stands behind the patient and performs the examination. So under local examination, we have something called as inspection, palpation, and auscultation. So under inspection, there is a method, that is a Pizillos method. Okay, there is Pizillos. As you can see in the image, there is a Pizillos method. So in this method, the hands are placed behind the head. You can see in the image, behind the head, the patient is asked to push his or her head backwards against the clasped hands on the occipital region. Then you have to ask the patient to swallow and watch for the movement of thyroid gland. And in normal scenarios, if there is a normal functioning of thyroid gland, it moves upwards on deglutination. Or in Pizillos method, you can see the enlargement of the thyroid gland also. Okay, so this is coming under inspection. So important under inspection of a thyroid gland or local examination of a thyroid gland, Pizillos method. Next, coming to the palpation. Coming to the palpation, again, you have to, the physician has to stand behind the patient or in front of the patient. So this should be done with the patient's neck slightly flexed. The gland may be palpated from the behind and from the front. So as you can see in the image, you can palpate the gland from the behind and also from the front. Every part of the gland is palpated to note about the nature of the swelling, including the size, shape, consistency, and mobility also. And also you can differentiate whether there is a hard or soft swelling and palpation. And last pointer, so you have been palpated with thyroid gland for its size and shape, but also it is important for palpation of cervical lymph node should also be palpated if at all you are suspecting a thyroid malignancy, where in case of thyroid malignancy there will be also cervical lymphadenopathy. So it is important for you to palpate the cervical lymph node if there is any enlargement. So this is the palpation in case of thyroid disorders. Next, coming to auscultation. So, in primary toxic goiter, a systolic bruit may be heard over the goiter due to increased vascularity. In case of primary toxic goiter, where there is a increased vascularity due to a chronic inflammation, where a systolic bruit can be heard in case of auscultation. So that's regarding the local examination, that is inspection, palpation, and auscultation. Whereas in inspection we have Pizillos method. Palpation, it is like we have to palpate from the behind and from the front, and also we have to palpate for its shape, size, consistency, and also the mobility. And also it is important for you to palpate the cervical lymph node if at all you are suspecting a thyroid carcinoma. So auscultation again. So next, last examination, that is a general examination. So general examination, where we have already discussed, that is a lid retraction. So as you can see in the image, there is a lid retraction. So lid retraction is like the upper eyelid is lying higher than the normal, and the lower eyelid is in its normal position. So you have to remember that the lid retraction is one of the finding in the case of hyperthyroidism. So lid retraction means the upper eyelid is lying higher than the normal, and lower eyelid is in its normal position. Next, second, that is exophthalmos. The first and foremost symptoms or finding in case of any hyperthyroidism patient is exophthalmos. So exophthalmos, the eyeball is pushed forwards due to the increase in fat or edema or cellular infiltration into the retroorbital space, leading to exophthalmos. And last, as you can see in the image, chemosis. You can see the redness there, chemosis. So chemosis refers to edema of the conjunctiva. So these are also be seen. So lid retraction, exophthalmos, chemosis. These three features can be seen more in the thyrotoxicosis case or a Graves disease case. Okay. So Graves disease case. So lid retraction, exophthalmos, and chemosis. So next general examination is these are the uh, related to eye features. Next, regarding the general examination, we have tachycardia, which will be seen in case of primary toxic goiter. Tremors of the hands will also be seen in case of primary toxic goiter, that is, especially the fine tremors. Moist skin, common in case of primary thyrotoxic cases, and we have to search for metastasis. If at all patient is if at all you are suspecting a malignancy in the thyroid, you have to look for other system also. So you have to search for metastasis also. So these are the general examination. Under the general examination, we have lid retraction, exophthalmos, chemosis, tachycardia, tremors of the hands, moist skin, and metastasis, that is searching for metastasis. So that's regarding the clinical examination of the thyroid disorders in detail. So next is investigation and interpretation. So investigation. So usually, if at all you are suspecting the patient is having any thyroid abnormality, the test which you will suggest is a thyroid function test. So already know, all of you know that thyroid function test. So thyroid function test includes thyroid stimulating hormone, the T3, T4, the FT3, that is free T3 and free T4. So here you can see we have differentiate different like T, if at all in case of primary hypothyroidism, where usually the TSH is increased, T3 is decreased, T4 is decreased, FT3 and FT4 is decreased. So in case of hyperthyroidism, there is increase of TSH, whereas there is decrease of all other T3, T4. Usually the disease condition will be autoimmune thyroiditis or Hashimoto's thyroiditis, congenital hypothyroidism, or post radioiodine therapy or thyroidectomy. If at all in second, if at all in some of the cases where you can see only there is increase of TSH, whereas there is a normal level of all others, that is T3, T4. So this is considered as a subclinical hypothyroidism or a sick euthyroid syndrome. Okay, so also some of the drugs like phenytoin, carbamazepine, and barbiturates also causes increase in TSH level. So next, coming to secondary hypothyroidism, where usually there is a decreased TSH, decreased T3, decreased T4, and also FT3, FT4 will be decreased. There is involvement of pituitary pathology, that is a pituitary or hypothalamic dysfunction, and also in case of sick euthyroid syndrome also, and usually it can be present in the second and third trimester pregnancy. And second, that is a normal level of TSH, and all other T3, T4, FT3, FT4 is decreased. Also, we can expect it there is a pituitary or hypothalamic dysfunction, or usually there will be an error in the lab or assay array. We can suggest if at all TSH is normal and all other T3, T4 are decreased. Next, under hyperthyroidism, usually we all know that THH should be decreased and all T3, T4, FT3, FT4 should be very high. So if TSH is decreased and T3, T4 are increased, it is the disease condition can be the Graves disease, toxic thyroid adenoma and toxic multinodular goiter. And in second scenario where TSH is decreased but all T3, T4 are normal, you can consider it as a subclinical hyperthyroidism, or you can consider a patient has recovered from an acute illness, or a patient may be taking the drugs like dopamine and steroids, or the recent treatment of hyperthyroidism. So if at all TSH is decreased and all other T3, T4 are in the normal level, you can understand this is condition as it is a subclinical hyperthyroidism or a recovery from acute illness. And the third case scenario where TSH is increased, all like TSH, T3, T4, all are increased. The third case scenario, all are increased. We can understand there is a pituitary tumor, thyroid hormone resistance syndrome, and thyroxine replacement therapy. So usually, the pituitary tumor will have these features where all TSH, T3, T4, FT3, FT4 will be increased. So this is how you have to interpret the thyroid function test. Based on that, you can note down this, very important and very easy to remember this, where hypothyroidism, just remember hypothyroidism, TSH will be increased and other T3, T4 will be decreased. In case of hyperthyroidism, TSH will be decreased and all other T3, T4 will be in the increased state. So that is regarding the thyroid function test basic. So it's not only the TSH, T3, T4, and FT3, FT4. We have some other investigations also, where usually some of the patient where we can see symptoms of hyperthyroidism or hypothyroidism, but still the thyroid function test will be normal. So where there may be involvement of autoimmune pathology like Hashimoto's thyroid disease and Graves disease. So for that you have to know this investigation, that is anti-thyroglobulin antibody test and anti-TPO. So whenever you suspect patient having autoimmune thyroid disease, you have to suggest this test. But usually in most of the cases, if at all you prescribe only TFT, that is a TSH and T3, T4, it will be sometimes normal in most of the cases, but patient will be having the autoimmune pathology. So it's too late to know that, but you have to understand this. So if at all you're suspecting a autoimmune pathology, you have to prescribe anti-thyroglobulin antibody test and anti-TPO. So thyroid peroxidase antibodies. TPO antibody test is used to distinguish between different types of goiter. It is always positive in Hashimoto's disease and Graves disease. If a patient is having a Hashimoto's disease and Graves disease, anti-TPO is a best, and that is it is be positive in all the cases and highly sensitive test to rule out a autoimmune pathology, anti-TPO. So that's regarding the thyroid function test. So next, if at all patient is having the enlargement of the gland, so you have to know whether it is a benign or malignant, or you have to know whether the size, what is the size of the gland, how much it has an increase. It is best to suggest thyroid imaging, or you have to prescribe USG thyroid, where usually we can know whether it is a benign or malignant, or the size of the gland can be known. So thyroid imaging, that is the USG of thyroid. And last, even though the USG thyroid is not it will suggest the benign or malignant, the gold standard to understand whether the gland, whether the swelling which is present in thyroid gland is carcinomatous, it is important for you to know the FNAC study, fine needle aspiration cytology study is also important, where it is usually done in case of a tertiary center if there is any goiter or thyroid swelling. So these are the investigation and interpretation. So thyroid function test, uh, we have like TSH, T3, T4, FT3 and FT4, and also we have some other if at all autoimmune pathology is there, we have tests like anti-thyroglobulin antibodies, anti-TPO, that is thyroid peroxidase antibodies, and also if there is any goiter or if there is any thyroid swelling is present, you can go for USG of thyroid. And also for further, if at all you are suspecting a malignancy, where usually you can go for a FNAC study also. So that's it regarding the thyroid disorders. And here, students, you have to remember, you can expect a 5 marks question. Like the question can be like, explain hypothyroidism with clinical features and clinical features and examination. Or they can straight away ask the investigation to be done in case of hypo or hyper, for 5 marks. And also there might be a question of multiple choice also. Okay, so that's it. Thank you.
Uh, Thank you, sir. The session was very clear and informative for both exam purpose and clinical practice. Our team Panchajanya is very grateful to you, sir, for taking up the session.
Thank you.
And if any queries, we'll be reaching out to you, sir.
Sure, sure. You can put on the comment section if there is any doubts. Thank you.
Okay, sir. Thank you. Thank you so much.